Bismillahirrahmanirrahim. Our topic is observe the effect of anti-inflammatory drug using Hind Paw method. Anti-inflammatory effect of drug by Hind Paw method. Inflammation is a process by which your body's white blood cells and the things by may protect you from infection from outside invaders such as bacteria and viruses. The word inflammation comes from the Latin inflammo, meaning I set a light, I ignite. Inflammation is part of the complex biological response of body tissues to harmful stimuli such as pathogens, damaged cells, or irritants, and is a protective response involving immune cells, blood vessels, and molecular mediators. The function of inflammation is to eliminate the initial cause of cell injury, clear out necrotic cells and tissues damaged from the original insult and the inflammatory process, and initiate tissue repair. Based on visual observation, the ancient characterized inflammation by five cardinal signs named redness, this is rubor, swelling or tumor, heat, calor, only applicable to the body's extremities, pain, dolor, and loss of function, which is functio laesa. The factors that can stimulate inflammation include microorganisms, physical agents, chemicals, inappropriate immunological responses, and tissue death. Infectious agents such as viruses and bacteria are some of the most common stimuli of inflammation. What are the three stages of inflammation? The three stages of inflammation including phase 1, phase 2, phase 3. In phase 1, inflammatory response, healing of acute injuries begins with the acute vascular inflammatory response. In second phase, repair and regeneration. In third phase, remodeling and maturation. There are two types of inflammation, in acute inflammation and chronic inflammation. People are most familiar with acute inflammation. This is the redness, warmth, swelling and pain around tissues and joints that occurs in response to an injury, like when you cut yourself. Chronic inflammation is also referred to as slow, long-term inflammation lasting for prolonged periods of several months to years. Generally, the extent and effects of chronic inflammation vary with the cause of the injury and the ability of the body to repair and overcome the damage. Several things can cause chronic inflammation, including untreated causes of acute inflammation, like an infection or injury, and autoimmune disorder, which involves your immune system mistakenly attacking healthy tissue. Long-term exposure to irritants like industrial chemicals or polluted air. The most commonly used method estimate the volume of edema formed. In this study, we present a novel method for measuring the volume of pathologically or artificially induced edema. In this model, a liquid column is placed on the balance when an object is immersed. The liquid applies a force F to attempt its expulsion. Anti-inflammatory activity. Measure the red paws by using vernier caliper before injecting the drugs or taking the control reading. 0.1 ml of acetic acid is injected to animal for the induction of edema. Acetic acid is injected to the subplantar tissue of the left hind paw of the rat, and the right hind paw served as normal. After 5 minutes, measure the edema size and take two readings at 10 and 5 minutes. The anti-inflammatory agent is administered orally by using a feeding tube. Wait for at least 30 minutes. The paw volumes of the rat are measured using the vernier caliper at 30 minutes, 35 minutes and 40 minutes. This is the procedure of anti-inflammatory activity. Lethosmometer test serves to measure the effectiveness of anti-inflammatory agent to reduce edemic conditions. In use, the paw is inserted into water contained in a special water cell of which the resistance is changed due to the immersion of the animal's paw. Carrageenan is a strong chemical that functions in stimulating the release of inflammatory and pro-inflammatory mediators, including bradykinin, histamine, tachykinins, reactive oxygen, and nitrogen species. 0.1 ml of 1% weight by volume carrageenan solution in normal saline is injected to animal. Carrageenan is a sulfated polysaccharide obtained from seaweed Rhodophyta. It causes inflammation by releasing histamine, 5-HT, bradykinins, and prostaglandins that produce inflammation and edema. The anti-inflammatory agent is administered orally by using a feeding tube. After 30 minutes of administration of drug, 0.1% carrageenan solution in normal saline is injected to the subplantar tissue of the left hind paw of the rat and the right hind paw served as normal. The paw volumes of the rat are measured using the digital lethosmometer at intervals of 0 minute, 10 minutes, 20 minutes and 30 minutes. Lethosmometer is a highly useful tool to evaluate the inflammatory response experimentally induced in small rodents and to screen potential. If you like our presentation, please like, share and subscribe to our channel and be sure to press the bell icon. Thank you for watching our video.